Hello everyone, this is Dr. Priya here and welcome to New Roots Hair Clinic. Today we are here to discuss it is okay to not use finasteride after hair transplantation. Well, this is one of the most common questions that I get before and after surgery from patients during consultation. They'll ask me questions like can we avoid taking finasteride after surgery, or if hair transplantation is possible without finasteride. Well, hair transplant surgery is a life-changing procedure for many people, and in order to maintain the results, patient asks questions like is it necessary to take finasteride, and if yes, then until when? Well, the answer to that question is yes, you have to take finasteride. There's no two ways about it. Now let's discuss why finasteride is compulsory after hair transplantation. Well, male pattern baldness generally persists over time, and it can make a person lose their hair over a longer period of time. So in order to control that, you have to take finasteride. Until you continue taking finasteride, 91% of the patients will not lose their hair. But for some reason, if you decide and stop finasteride, you may notice hair fall again. Please remember that hair transplantation is not a cure for male pattern baldness. It only covers your bald patches. Finasteride prevents hair loss from the transplanted as well as from the existing portion of hair. If this medicine is not taken after transplantation, it can lead to an undesired result as the male pattern baldness progresses. Taking finasteride after hair transplant surgery will help you prevent hair fall in the future, and it will also help you preserve a head full of hair that you naturally possess. Taking oral and topical finasteride will help you retain both the existing as well as the transplanted hair. It will also help to reduce or avoid any chance of a redo surgery in the future. Now let's discuss till when one should use finasteride. Well, we have discussed this before also, that finasteride needs to be used consistently to show its effect. This means that you'll have to take this medicine as long as you want to keep your natural hairline. Well, this medicine is out there in the market since 1992. And after 30 years of research, it was concluded that it can be used safely for a longer duration of time. But there are certain points that needs to be considered, like your age, grade of baldness, amount of hair fall, your lifestyle, because all these points matters. I hope I was able to answer all your questions. If at all you have anything to ask, please feel free to ask. I'll see you again with a new video. Till then, please take care.